My name is Nila Hawkins, and today I will be discussing the Purdue Pegboard assessment. The Purdue Pegboard is a standardized assessment that consists of 4 uni- and bimanual subtests. It is also one of the most widely used tests of hand function for therapy, rehabilitation, and treatment assessment purposes. The Purdue Pegboard tests the quality and the speed of performance of the hand as the person accomplishes a task. More precisely, it assesses proficiency of one particular grasping pattern, the precision grip. The precision grip style allows humans to perform most precision handling tasks, such as writing, buttoning, tying, and picking up small objects. It also involves continual adaptation and is a crucial component of normal hand function. As I mentioned before in the previous slide, the Purdue Pegboard assessment is to measure gross motor movements of the hands, arms, and fine fingertip dexterity. This assessment is used for patients with impairments of the upper extremity resulting from neurological and musculoskeletal conditions. This assessment is suitable for clients presenting with lateral brain damage, clients requiring assessment for vocational rehabilitation, and clients with dyslexia. The Purdue Pegboard can be administered with clients ages 6 and up. The materials you will need as the administrator is an instruction manual, 1 test board, 50 pins, 20 collars, and 40 washers. You will also need a score sheet, a testing table approximately 30 inches tall, and a stopwatch or a clock that reads in seconds. Now I would like to discuss testing. The patient should be seated comfortably at a testing table with the Purdue Pegboard on top of the table in front of him or her. The testing board consists of a small board with 4 cups across the top and 2 vertical rows of 25 small holes down the center. The 2 outside cups contain 25 pins each. The cup to the immediate left contains 40 washers, and the cup to the immediate right of the center contains 20 collars. The 4 subtests in the Purdue Pegboard assessment involve timing the client's ability to place pegs in small holes with his or her dominant hand, non-dominant hand, and both hands bilaterally within a 30-second time period. The 4th test consists of 4 alternate use of the hands while building as many assemblies as possible in 1 minute. And just to clarify what I mean by assemblies, I'm talking about the pins, washers, and the collars. As the administrator, you want to make sure the client is not compensating in any way. So for example, you want to make sure that your client is putting in the pins on the right and left side symmetrically at the same time. Now I will go on to discuss scoring and score interpretation. The testing should commence in the order that I have outlined, unless the client is left-handed. Tasks 1 and 2 should then be reversed. The preferred method of the administration is the 3-trial method. The patient should be permitted to attempt 3 trials for each task after a single demonstration by the clinician. The 1-trial administration method only permits the patient 1 trial following a demonstration by the clinician. You want to make sure as the administrator that you are keeping up with your client's individual scores. For example, let's say the client has his or her left hand, their left hand placement was 12 pins, the dominant hand was 15 pins, the bilateral assessment was 12 pairs of pins, and the assembly was 20 pieces. You would need to document the individual scores and add the left placement, right placement, and bilateral pin placement together to get the sum of scores. The test can be administered in an individual or group setting. A low pegboard score can be a sign of a musculoskeletal disorder, poor coordinated movement, or a neurological impairment. Now I will go on to discuss the psychometrics of the Purdue Pegboard. The validity and reliability have been well established throughout an abundant amount of research in healthy populations, as well as a variety of diagnostic categories, including Parkinson's disease and multiple sclerosis. The validity and reliability of this assessment has been tested on numerous occasions with several different populations, but new norms for the general population have not been published. Therapists need to know whether the 3-trial administration is necessary to use for persons with disabilities, such as multiple sclerosis. Now I will go on to discuss the retest reliability in the population diagnosed with schizophrenia. The 3-trial administration method was found to have excellent retest reliability for subtests. The 1-trial administration method was found to have poor retest reliability. The results from this study found that the 5 subtests of the Purdue Pegboard were between 0.73 and 0.88, indicating moderate to good retest reliability on patients with schizophrenia. These results are consistent with the results from the healthy aging individuals and slightly lower than those from students and persons with multiple sclerosis. In general, these results suggest that the Purdue Pegboard assessment is a reliable measure for tracking the change in hand dexterity of patients with schizophrenia over time. Now I would like to go on to talk about the retest reliability in population diagnosed with multiple sclerosis. So in this study, it suggests that any change in the Purdue Pegboard score when used with persons with multiple sclerosis may be attributed to actual changes in the person and not to a practice effect, with the exception of the sum of 3 trials for the bimanual subtest. And here I've just compiled the normative data. I've separated them in 3 charts. So the first chart that you see on your left is the mean performance of young adults, which was 1 trial per subtest, and the average age was from 15 to 80 plus years old. The second chart that I have here is the performance of children on the Purdue Pegboard, which was also 1 trial per subtest. And the boys in this trial, their ages range from 5 to 15. And the last chart that I have is for girls who were also tested on 1 trial per subtest, and their age ranges were also 5 to 15. And now I would like to discuss the consideration for occupational therapy practice. The reliability of the Purdue Pegboard for assessing persons with disabilities other than multiple sclerosis still needs to be examined. The relationship between a person's Purdue Pegboard score and functional performance also needs further research. And lastly, as a payment for occupational therapy services, research must document an improvement in dexterity is related to an improvement in functional performance. And here are the list of my references, and thank you for watching my video.